Okay, let's start our class. Good morning, ladies and gentlemen. My name is Zheng Guangsen. I come from the Department of Oral Maxillofacial Surgery, Guanghua School of Stomatology, Sun Yat-sen University. Today, I will share you the introduction of stomatology. From these three parts, the history of stomatology, what do the stomatologists do, and the connection of the stomatology and the medicine to outline this lecture. Part 1, the history of stomatology. From the cartoon, we will see who is the world's first dentist. From the Asian origin, the scientists found that the Asian humans' teeth have the low rates of the dental decays. But however, the severe attrition of the teeth were found. This is due to the low carbon hunter-gatherer diet. As we know, before the agricultural society, the Asian humans, they eat vegetables, fruits, nuts, roots, and meats. And after the farming society, the humans eat the grains and sugars. And the growing of the farming society from 10,000 years ago correlated with an increase with the rate of 2 decades. The sugar and decay, they are highly correlated. The sugar was was very popular in the British. And the teeth, once upon a time, the teeth of the British are very bad. The high incidence of dental decays date back to 14,000 years ago in Italy. Infected teeth were founded by scientists. On the teeth, it is partially cleaned by the flint tooth. This is the oldest known dentistry. Can you still hear me? And date back to 7,000 BC in the Indus Valley of India and Pakistan. The bee makers, they use the bowl jewel, as we see in the center. This is the bowl jewel to jewel open the teeth to remove the dental decay and cure the tooth problems. This is the earliest dental jewel. And date back to 6,500 years ago in Slovenia, the people use beeswax, a special material, the beeswax, to fill the dental decays. As we know, this beeswax is very soft. After we eat or chewing something, it will be broken. And date back to 5,000 BC in Sumer, which is located in modern Iraq. A text described the true warmth as the cause of dental decay. And this true warmth, this belief, has also been found in ancient India, Egypt, Japan, and China. Until 14,000s, the French A French surgeon proved the bacteria as the cause of the decay. And date back to 3000 BC in ancient Egypt, scientists found a mandible with two perforations just below the root of the first molar, and which is this is this might be the drainage established by Asian dentist with an abscess teeth. And date back to 2600 BC in ancient Egypt. The first identified dentist was found. The tomb of Hazarea includes the title "The greatest of those still with the teeth and of physicians. He is the first known dentist. Has a year. And the first dental textbook was found in 1550 BC in ancient Egypt. A textbook described the treatment of the tooth decades, infection of the loose teeth, dislocated and fractured jaws, and date back to 700 BC. The first bridge was found. The bridge is not the bridge we have seen now in the on the road. This bridge is a denture which to fix the to replace the missing teeth. And in the ancient time, people used the human teeth or the animal bones to uh, to replace the missing teeth, and they use the golden wire to to fix the teeth together with the natural teeth. The estrogen practice dental prosthetics use gold crowns and bridgeworks. Around 500 to 300 BC, Hippocrates and Aristotle was considered the pioneer of dentistry. They wrote about dentistry, including the eruption of the pattern of the teeth, treating the decayed teeth and gum disease, extracting teeth with forceps, and use wire to stabilize the loose teeth and fractured jaw. Around 100 BC, a Roman medical writer, Celsius, wrote about extensively in his important compendium of medicine on oral hygiene, stabilization of loosened teeth, and the treatment of the two decades, tooth pain and fractured jaw. In the ancient time, the Romans used the urine as the mouthwash in about 1 AD. In the beginning of the profession in the Middle Age. In China, in Tang Dynasty, first amalgam was documented in about 659 AD, and it appeared in Germany in 1528. And the first toothbrushes still was found in Tang Dynasty in China. And the Maya in 800 AD in Maya, the Asian Maya of all society class filed their teeth in decorative patterns, and they make of jade. In 1210 AD, a guild of barbers was established in France. The barbers eventually evolved into two groups: the surgeon barbers, who were educated and trained to perform the complex surgical operation, and the lay barbers, or barber surgeons, who performed more routine hygienic service, including shaving, bleeding, and tooth extraction. And this lay barbers, the early modern dentist. Can you hear the sound of the video? Can you hear the sound of the video? The video says in the Middle Age of England, people go to the barber surgeon or blacksmith to have their teeth extraction. Sorry, I explained. In the Middle Age of England, people go to have their tooth extraction, go to the barber surgeon or blacksmith. In 1530, the first book focused solely on dentistry was the Ashley Buchan in 1530, written for barbers and surgeons who treat the mouth. It covers practical topics such as oral hygiene, tooth extraction, jewelling teeth, and placement of gold filling, and the development of profession in 18th century. Pierre Fauchel was considered as the father of the modern dentistry. He was first to describe a comprehensive system for the practice of dentistry, including basic oral anatomy and function, operative and restorative techniques, and denture construction. And he proves the P.1 theory wrong. In 1776, Paul Revere verified a death of his friend Dr. Joseph in the Battle of Breeze Hill, and he identified by identifying the bridge that he constructed for him. This is a denture he found in the dead body of his friend, and this is the first case of dental forensic. In 1816, a Frenchman, Nicolas, received the first patent for porcelain teeth. As we know, in the ancient time, date back to Tang Dynasty in China, people used the amalgam which the alloy made of silver and mercury to fix the teeth, to fill the teeth. However, this amalgam, the color of the amalgam differs from the actual teeth and it's very unacceptable to use as a dental filling in the front teeth. So this porcelain teeth is a very acceptable by peoples. 1719, one of George Washington's dentists, John Greenwood, construct the first known dental foot engine using his mother's foot treadle spin to foot treadle spin wheel to rotate a drill. This is the first dental foot engine, and date back to the Asian India and Pakistan. The bee makers used the bow drill. Remember the bow drill to drill open the teeth, and this is the foot engine. And this is the foot engine. This is a foot pedal. A foot pedal, when we step on the foot pedal, can generate power. It can provide several hundred RPM of speed to drill open the teeth. And this, the denture made for George Washington by John Greenwood. This is George Washington's denture. It's made of the metal and animal's teeth. It's, it fits very badly in the mouth. And once upon a time, people make the denture by using the dead man's teeth. Once upon a time, in the early 19th century, human teeth became an increasingly valuable commodity. In fact, they were so in demand that grave robbers can earn 10,000 pounds a night stealing the teeth from the corpse. These teeth can use to make the lifeline dentures for the rich. This is Waterloo teeth. As we know, there's a Battle of Waterloo. A lot of soldiers die in the Battle of Waterloo, and human and people use the dead soldiers' teeth to make the denture. Advanced in science and education in 19th century. In 1839, American Journal of Dental Science, which was the world's first dental journal, began to publish. And the first dental school was found in 1840 by Hayden and Harris, which was the Baltimore College of Dental Surgery, and this school merged with the University of Maryland in 1923. And the first general anesthesia was successfully managed by dentist William Morton in 1846. and he used the ether for anesthesia for the surgery of a neck abscess of the neck. In 1867, the Harvard University Dental School was founded, which was the first university-affiliated dental institution. The first dental X-ray was taken in 1896 in New Orleans dentist Edmund. In 1899, Dr. Engel described the classification of malocclusion, and he is the pioneer of the orthodontic, the founder of orthodontic. Sorry. He also established the first school of orthodontics in 1900 and the first orthodontic society in 1901 and the first dental specialty journal in 1907. Innovation in techniques and technology in 20th century. The founder in 1908, Dr. Dewey Black developed the first classification of dental cavity and standardized the operative procedure of dental filling. In 1949, Oscar, a Swiss chemist, developed the first system of bonding acrylic resin to dentin, and in 1955, Michael described the acid etch technique, a simple method of increasing the adhesion of acrylic filling to enamel. In the past, we used amalgam to fill the decayed teeth, and this amalgam they cannot adhere to the teeth. They just we have to drill open the teeth and make the cavity a special form to 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 sorry. We have to drill the cavity in a special form because the amalgam has not did not adhere to the enamel or the dentin, and we can use the acrylic resin just adhere to the dentin and enamel after these two bonding systems were developed. In 1957, John Borden introduced a high-speed air-driven contra-angle handpiece, and this air motor obtained the speeds up to 300,000 RPM. It can drill open the enamel very easily. In 1980, Dr. Brennemark described the technique for osseointegration of dental implants. And the history of modern stomatology in China. In old China, the dentistry is like this. And the first dental hospital was founded in 1905 in Chengdu by a Canadian dentist, Lindsay, which named the dental faculty of West China Union University. And this is the first stomatology hospital in China. In Guanghua School of Stomatology in 1908, the Guanghua School of Medicine was founded in Guangzhou by Dr. Zheng Hao, and this is the School of Medicine, not for the stomatology or dentistry. Dr. Zheng Hao was the first Chinese who was permitted to practice in the U.S. And this is the Guanghua School of Medicine, and then the Guanghua School of Medicine was merged into Sun Yat-sen with the medical school, and Guanghua School of Stomatology was founded in 1974. And this is the first graduate in 1977. And this is Guanghua School of Stomatology. Hospital of Stomatology in our school. And part 2, what do the stomatologists do? And actually, we do a lot of work, the operative dentistry and endodontics, pediatric dentistry, oral and maxillofacial surgery, periodontology, oral medicine, periodontics, orthodontics, oral implantology, and preventive dentistry. And there are a lot of other related courses such as oral anatomy, occlusion, oral histopathology, oral biology, dental materials, oral and maxillofacial radiologists, and oral clinical pharmacy. I will explain to you one by one. First, the operative dentistry and endodontics. And the doctor in this department treated with dental decades. And as we know, in the the dental decades involved enamel, and then it developed to the dentin, and then the dental decade will invade the dental pulp, and cause the inflamed pulp, cause pulpitis, and then the pulpitis will develop abscess of periapical region. The endodontics treat this dental decays, the tooth pain. They perform this root canal treatment. This root canal treatment to treat the pulpitis of the teeth. And the pediatric dentistry, they manage the tooth problems of the child, and Sometimes they also manage the facial development of the child. Periodontology and they concerned about the periodontal tissues, such as the gum and periodontal periodontia of the teeth. And when we, as we see in these photos, sorry, as we see in these photos, a lot of dental tartars or calculus was found in the teeth, and this gingiva was recessed, and some gingiva was swelling. This patient will suffer from periodontitis, and the periodontologist manage this periodontitis or gingivitis of the patient. And oral medicine, they concerned about the disease in the oral mucosa of the in the mucosa of the oral cavity, such as this leukoplakia or some lichen planus. The department of prosthodontic, they concerned about how to fix the missing teeth. If the teeth are partially missing, they will fix the teeth with the crowns or the dentures, the crowns. If several missing teeth was found, the dentition was not complete. They will fix the teeth with partial removed denture, such as this. If the patient, if the teeth or the patient, they are all gone, and the prosthodontist, they fix the teeth by these full dentures. This is how this is a procedure of making a full denture. First, we will have articulates to mimics the edentulous mouth of the patient, and then we will have the teeth on the denture, and this is a wax. We will have the gingival morphology, and then we will use the stone and acrylic to make the full dentures. Also, this prosthodontics, they use the technique of making dentures. They make the face, the fourth face for the patient who will receive a comprehensive resection of the tumor of the face. The department of orthodontics, concerned about the alignment of the teeth, and malocclusion was very prevalent in the modern humans because the diet change and the social demand, and they align the teeth in a much in a to achieve a much more much better occlusion. And the implantology, the doctor of implantology, they concerned about replacing the missing teeth by implants, the dental implants, which was developed in the latest 30 years. Preventive dentistry. The doctors in the preventive dentistry department, they teach the people to protect their teeth by using the dental floss and you and the rinse the oral rinse uh, to 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 prevent the gum disease. And the preventive dentist also perform this sealing of the teeth to protect the teeth from dental decay. A doctor from the oral and maxillofacial surgery, they concern about many problem of the face and the head and neck region. And first, they do the exodontia, and the majority of the modern human being will have the wisdom teeth problem. The wisdom teeth might be impacted to cause pain and cause swelling of the local region, or cause the second molar decay and cause some osteogenic tumor. Means that the tumor originate from the teeth, and the oral maxillofacial surgeon will perform the exodontia, which mainly for the wisdom teeth extraction. Also, the mucosa in the oral cavity might have some malignancy, such as squamous cell carcinoma. And in some regions, such as India and such as Hunan province of China, they are because they eat the betel nuts, which is highly carcinogenic for the oral mucosa. The oral maxillofacial surgeon performed the surgery of this oral squamous cell carcinoma of oral mucosa. Also, the oral maxillofacial surgeon performed the orthodontic surgery, which was very popular in the recent years. This orthodontic surgery correct the jaw spatial relationship by remove forward and backward the upper jaw and lower jaw to provide the patient a more reasonable position of the jaw and more harmonic facial contour. And this is this is a case of orthodontic surgery. A patient with the underbite, and we move the upper jaw forward and move the lower jaw backward, and provide a much more harmony profile for the patient. And this young lady had the opposite situation with the overbite and with a little chin, and we move the lower jaw forward and the upper jaw backward to make her more harmony in facial profile and have a better occlusion. And this young lady have asymmetric face, and we use the orthodontic surgery to perform the double jaw surgery and provide her a more symmetric face. And also, the oral maxillofacial surgeon managed some congenital deformities, such as the cleft lip and cleft palate. This is a video for repairing of the cleft lip. This cleft lip was congenital disease in about 1 in 600 newborns. First, we have designed the incision and cut open the incision and have the auricular oris reposition the muscles. and then close the clip, close